Hello, Danny Gilmore, Week 8 Video Journal. This week's topic is CBT and DBT and specific techniques that were used in clinic to change patterns in behavior. Like, for example, if somebody is withdrawing, they're depressed, use like behavior activation, identifying activities that the client finds enjoying or fulfilling. So we encourage the client to introduce activities in their daily routine on a regular basis, engaging positive activities, giving them a sense of accomplishment and pleasure. Like, we had a patient that pretty much was agoraphobic, didn't want to go outside, and the therapist recommended just taking a walk, around the block to start, and then engaging a friend to take a walk with the patient, slowly getting them out of the house and increasing their exposure. It's almost like exposure therapy for anxiety and phobias. And how I'd use it in my clinical practice, just doing that. Exposure therapy, doing thought records, like I said, just the behavioral activation, finding out what those triggers are and journaling them and replacing them with a positive activities. You could do relaxation techniques, deep breathing, progressive muscle relaxation, mindfulness, which is a little bit of DBT as well, problem solving skills, doing psychoeducation. So it looks to me like DBT is mostly used for personality disorders. Specifically borderline personality disorder. Because those people have like an unstable self-image, impulsive, self-destructive, difficulties in relationships, and the evidence is that DBT is the gold standard of that. Also, substance use disorders, eating disorders, PTSD, of course, self-harm behaviors. And mostly my preceptor has been doing EMDR, but we have done a couple of CBT, but they more tend towards the EMDR because a lot of the patients have trauma. So, but yes, I have seen a few CBT sessions, and there were a couple of telehealth sessions that were mostly CBT. One kid was having trouble in school. His parents were concerned about him, and my preceptor did mostly motivational interviewing. So not a lot of CBT, mostly EMDR, which I think a lot of people would be happy about that. But I did want to see a little bit more CBT. But I'm very thankful and grateful that I got to see mostly EMDR. Because when I tell other students that, they're like, "What? You got to do EMDR? That's awesome." And I'm like, "Yeah, but but it's great. I'm very happy and thankful, and thank you."